At this time, I would like to introduce our guest speaker today, Brian Boswick from Transamerica.
Thank you, Jonas. I appreciate the opportunity to help with the webinar this morning. We've got a lot of fantastic information. As we get started, I wanted to make sure that everyone on the call has a good idea of where Americans currently receive their health insurance. So we all know that there's roughly 325 million Americans. Currently, about 190 million Americans get their insurance through some employer-provided plan. This would be families that are getting their insurance through their employers or their spouse's employment. The next largest group are those who are on Medicare, and we're going to take a deep dive when it comes to Medicare insurance today. There's roughly 70 million Americans between the Medicare and Medicaid systems. You have 12 million Americans on the Affordable Care Act, and there are still 28 million Americans with no insurance in this country. We're going to spend the majority of today's time focusing on Medicare, what it is, when you sign up, what it covers, and how much it costs. But before we get into that, it's important to recognize that there are a lot of Americans who retire before Medicare eligibility. And if you are retired and therefore don't have access to a group health insurance plan or an employer-provided plan, you are on your own to go out there and purchase insurance. Obviously, with the passage of the Affordable Care Act years ago, it is the place, and so we wanted to start there. The website in front of you is www.healthcare.gov. It's the Affordable Care Act website. And we're going to walk you through a scenario this morning, and I would encourage, if you are in a position to open up the web page yourself, I would encourage you to type along with me. I will try to go slow. So up in the search bar, I'd like to type in the word "See Plans and Prices." And we click the second link. Now, the Affordable Care Act is a national health care system, but it's administered on a county-by-county basis. So I'm speaking to you from Wisconsin this morning, and so I'm going to type in a local zip code. And we're just going to go through and answer these questions. The first one is, who's in your household? In this case, we're going to run a couple. Are you married? In this case, the answer is yes. We're going to assume that this particular couple has no dependents. We're going to type in their ages of 62. Outside of the Affordable Care Act, for someone who's no longer working and not yet Medicare eligible, the only solution is COBRA insurance. And most of you on the call, if you've ever had an experience with that, you understand that it is not an inexpensive proposition. So please note that I just typed in a 62-year-old couple. Notice the question, expected income. The way the Affordable Care Act is priced is it's based upon income. And they want to know the calendar year's income, or said simply, the income for the insurance year. Insurance through the Affordable Care Act runs from January 1st to December 31st of each year. And so since we're still in 2019, it would like to know the answer to that question. We're going to start and look at two different income numbers. The first is $66,000. Notice that just by typing 66,000 or any number above there, the definition of income is modified adjusted gross. It says neither person is eligible for a premium, savings, or a tax credit. Most might not know what that means, but take a look at this. In Ozaukee County, for a couple, both age 62, with income at or above $66,000, there are 24 plans available. The least expensive plan is $1,704.56 a month. Please notice the deductible, almost $16,000. This would clearly be a high deductible plan. You are able to scroll through and just notice how the premiums change. But let's go all the way to the opposite end. We looked at the least expensive plan. Now let's look at the most expensive. And notice this, that the most expensive plan for that couple, again, $66,000 in income or higher, The monthly premium alone is almost $3,500, and you still have a family deductible of $5,400. I consider that almost like not having insurance at all. You have to spend over $40,000 before any insurance benefit kicks in. So you might be asking yourself, why would this guy show us this? Because that looks like a horrible place to have to buy insurance. And I would agree with that. Let's go back and change one variable. We're going to make the $66,000 $65,000. Now notice they become eligible for a almost $2,000 a month tax credit or subsidy. Let's go back and take a look at the new cost of insurance. The original number was $1,704.56. And now the premium adjustment creates a 68-cent a month option. I think all of you would agree that the premium looks pretty good here. Yes, I recognize the deductible is still very high, but at least you're not forced to pay exorbitant premiums. The reason why we're sharing this with you is because this is what early retirees or those who are not yet Medicare eligible do for insurance. And not to get too far off the health insurance subject, but there are numerous ways that a person can logically or plan to keep their income low. Think of Roth IRA assets, right? And how to complement those with 401k assets. Or the subject we were able to speak on last week, Social Security benefits and their effect. I'm just going to scroll back to that most expensive plan and now take a look that with the premium adjustment, the cost of insurance drops down to $1,476 a month. Said simply, if you need to go to the Affordable Care Act and can't keep your income low enough, you'll consider COBRA a good deal. But obviously, the Affordable Care Act provides a solution or a potential solution for individuals who have the ability to control the modified adjusted gross income they put up in a year. I'm now going to transition over to our Medicare presentation. As we get started, I'm going to set it up this way. A few months ago, I was talking to a physician. Yes, I said a physician, someone who works in the healthcare world. And he asked me if there were really 17 different Medicare choices. And I kind of chuckled and asked him, where are you getting that number from? He told me that was the number of Medicare brochures that had been mailed to him in the past few weeks alone. For those of you who are already 65 or getting close, you can appreciate this. You need a bigger mailbox as you turn 65. And all that extra mail, a good majority of it is coming from health insurance companies. And those health insurance companies want your business. All right? Medicare is not nearly as complicated as what we make it to be. So I told the physician, no, doctor, there are only two choices. Two choices when it comes to Medicare. And I'd ask that you remember that as we go through the Medicare materials themselves. As I mentioned before, there are over 70 million Americans insured by Medicare and Medicaid. You can see those who are clearly on the Medicare system itself. That number is 60 million. By the way, 11,500 baby boomers turn 65 every single day. There's a lot more coming to the Medicare system as we speak. All right. And today we're going to talk about how to take into consideration and budget for the premiums you have to pay and how those are added to by deductibles, co-pays, and co-insurance. Want to make sure that everyone enrolls on time to avoid penalties. And obviously, there are things that you can do in your financial plan to manage your income levels, which help reduce or control the cost of premiums. These are probably terms that are very familiar to you. Deductible, copay, and premium. Any person who's ever participated in an employer-provided healthcare plan would be very, very aware of these particular things. And when it comes to Medicare, not only do you have the choice of those two Medicare options I alluded to before, but you also have the opportunity, right, if you're still working, to, of course, participate in an employer-provided plan. To be clear, once you become 65 or older, you are able to participate in the plan at work or you can choose to freely go to Medicare. The one thing, you're probably never going to participate in both at the same time. So let's start with what is Medicare. Original Medicare is the Medicare system of our parents and grandparents. The insurance company, when it comes to original Medicare, is the federal government, and it is made up of 4 parts. Those parts are Part A, Part B, Part D, as in drugs, MEDIGAP insurance. The alternative to original Medicare is a Medicare Advantage or Part C plan. That insurance is offered through private insurance companies. And this particular slide, I want you to remember it, but at the very end in the summary portion of the presentation, we're going to redraw this in a little bit different way. Medicare Part A is specific to inpatient hospital care. Okay, the deductible for Medicare Part A is $1,364 for 2019. But please notice at the bottom of the slide that it's really good hospital insurance. You, after the first $1,364, will have 60 days covered in full. Your out-of-pocket cost is $0 per day for the first 60 days. My father's been a primary care doctor for almost 40 years. He's never had a patient confined to a hospital stay that exceeded 60 days. That doesn't mean it's impossible. It just means in today's healthcare world, it's very, very unlikely. You can see that the dollar amount per day grows as the amount of consecutive days grows. And you also have 60 lifetime reserve days at which you can tap at any point during your retirement. It's very, very good inpatient hospital care. That does not mean that everything you receive healthcare-wise in a hospital is coded as inpatient hospital care. Again, Medicare Part A is specific to inpatient hospital care. Now, please notice that there is a provision to cover some skilled nursing care. To be clear, this is not long-term care insurance. It won't replace long-term care insurance you have. The best way I can give you an example is to share one. My wife's uncle had double knee replacement paid for by Medicare 2 years ago. When meeting with the doctors, they assured him he would stay at least 3 nights in the hospital. The reason why he would stay at least 3 nights is once 3 nights consecutive are exceeded in a hospital stay, Medicare Part A will cover up to 20 days of skilled nursing care. That would be skilled care to rehabilitate the individual for what they were receiving treatment on. So my wife's uncle was able to go to a nearby facility, a very, very nice facility, and receive up to 20 days of therapy or rehab with 0 out-of-pocket expense to him. That's the skilled care provision Medicare Part A ties to. The second part of original Medicare is Medicare Part B. Medicare Part B applies to all the healthcare you get done outside of a hospital system. You can see the types of services it covers: doctor visits, durable medical equipment, necessary services. What's not covered is 20% of the total bill. Out on the Medicare website, they give you an example. You have a $50,000 non-hospital medical bill. The patient responsibility portion is 20% or $10,000. There is also an annual deductible of $185. For any of those of you in a high deductible plan, you probably love the sight of a $185 deductible. Now, Medicare Part B, those premiums are a direct reflection of the amount of income that an individual reported 2 years earlier. So please note this chart. It shows you an individual tax filer, and it shows you a joint tax filer. It shows you the amount of income, and corresponding, it shows you what would be their Medicare Part B premium. The vast, vast majority of American retirees pay $135.50 per month. But should your income cross through these thresholds, you can see the cost of Medicare goes up. This Medicare premium, Part B premium, readjusts annually based again upon 2 years prior income. These items are not covered by Medicare Part B. The good news is dental insurance is something that can be purchased outside. Same thing with vision insurance. The third part of Original Medicare, required by law since 2006, is Medicare Part D, that stands for drugs. You will purchase a drug plan from an insurance company. The government does not sell prescription drug plans. The cost of a Medicare Part D plan can vary significantly. Obviously, more expensive for those who take more expensive drugs, less expensive for those who don't. Depending upon the state you live in, I would check into something or an option that the state might administer. In the state of Wisconsin, there's something called senior care, a viable option, $30 a year for someone who's Medicare eligible, who doesn't take expensive drugs. Most counties have aging and disability resource centers. I would encourage everyone participating in today's webinar to reach out to your local office and see if they might have some tips on purchasing drug plans in your area. The average Medicare Part D plan costs $32 a month. Now, keep in mind, out-of-pocket costs may exist, and out-of-pocket costs when you're on Original Medicare mostly exist due to prescription drug out-of-pocket costs. Medicare Part D still has the donut hole. What that means is there is a portion of costs when it comes to drugs that you pay fully or almost fully for. This is an example of how a typical prescription drug plan would be affected by the donut hole. The last part of Original Medicare is your supplemental insurance. It is more aptly referred to as MEDIGAP insurance. What's the purpose of MEDIGAP insurance? To cover the gaps that Original Medicare does not. You will purchase your MEDIGAP plan again from a private insurance company, not from the government. Its purpose is to eliminate the out-of-pocket costs related to Medicare Part A or the out-of-pocket costs related to Part B. Starting in 2020, the $185 Part B deductible will no longer be reimbursed or covered by Medigap plans. That's the one big change as we look ahead to next year. You can see that supplemental insurance can be purchased in an a la carte fashion, right? You can buy specific plans. Most Americans purchase Medigap Part F. Medigap Part F covers everything that A and B doesn't, except for what you can see, it only covers 80% of any foreign travel plans. Let's go back and redraw this chart. And while we do this, I'm going to ask those of you who can, grab a blank piece of paper and a pen or a pencil. And on that blank piece of paper in the upper left-hand corner, write Original Medicare. In the upper right-hand corner, I'd ask that you write the words Medicare Advantage. And in between those two words, write the word or and circle it, underline it, star it, whatever you need to do. Remind yourself that no individual is on Original Medicare and an Advantage plan. You are on one or the other. Under the Original Medicare part, similar to the slide in front of you, we're going to draw it vertically as opposed to horizontally. Okay, so under the word original, I'd like you to draw a circle, and in that circle, write the letter A. To the right of that, a dollar sign with the number 0. I'll remind you, Medicare Part A costs $0 per month. Under that circle, a plus sign with another circle. In there, the letter B. To the right of that circle with the B in it, please jot down $135. That's the average Medicare Part B premium. Under that, one more plus sign, one more circle. In there, the letter D, as in drugs. To the right of that, a dollar sign with the number 32. The average Medicare Part D plan is $32 a month. One more plus sign under there one more circle, and in that circle, write the word MEDIGAP. The average MEDIGAP plan is $187 a month. If you add up A plus B plus D plus MEDIGAP, the national average is about $355 per month per person. That means full-blown Medicare with a supplement for the average couple participating in this webinar, you're going to need $700 a month just to cover insurance premiums alone in retirement. The good news is your out-of-pocket expenditures should be virtually zero if you insure that way. Let's finish with the alternative to Medicare. That is a Medicare Advantage plan. So under the words Medicare Advantage plan on the right side of the page, one big box. In that box in the upper left-hand corner, but inside the box, write A plus B. I will remind you that all Medicare Advantage plans have to cover what A and B do. You still pay your Medicare Part B premium, so by the A and B, write $135. In the middle of that big box, write the big letter C. And right near that C, write $28. The average Medicare Advantage plan is $28 above and beyond the Part B premium of $135, which means a person could be in a Medicare Advantage plan for as low as $150 a month. And how should you think of a Medicare Advantage plan? A lot like any employer-provided plan that you can participate in or have ever participated in. Medicare Advantage plans are, again, underwritten by private insurance companies. I quite often get asked, what about AARP? Does it benefit to buy their plan? Just so that you know, the AARP plans are underwritten by United Healthcare, Anthem. These are just examples of the insurance companies that offer Medicare Advantage plans. A Medicare Advantage plan is, again, an alternative to original Medicare. The advantage of an Advantage plan is low premiums. The disadvantage is, one, you have a predetermined network of doctors. 10 years ago, that was a lot bigger deal than it is today. Number two is you're going to have a copay. Notice that when we discussed original Medicare, the words copay did not exist, right? Because we eliminated those with MEDIGAP policies. When it comes to a Medicare Advantage plan, you will pay a stated copay every time you go. And finally, there will be a predetermined out-of-pocket maximum or deductible. The average Medicare Advantage plan has a $4,400 deductible. Said simply, it's a different way of doing insurance. As opposed to paying over $300 a month in premiums, you're going to pay $150. And the trade-off is you're going to have to pay something when you go to the doctor. When I do webinars like this, I get accused of sounding like I'm pro original Medicare with a MEDIGAP plan. Sometimes I'm accused of being pro Medicare Advantage plans. To be clear, I'm still not 100% certain of which one of these I'm going to choose at the time that I have to make that choice. Let's try to make it a little bit more simple for you. I quite often get asked the question, can I go from one to the other? And the answer is yes. Each year during the open enrollment season, which starts on October 15th, you could switch from original Medicare to an Advantage plan or vice versa. But it's important to understand that the only year of your Medicare eligible that you are guaranteed issuance of a MEDIGAP plan with no medical underwriting is in the first year you sign up. To be clear, that doesn't mean the year you turn 65. It means the first year you are 65 or older and not insured by an employer-provided plan. I recently had a client who just retired in July. July 1st was his first day, 92. He stayed on his employer-provided plan for the last 27 years. Now he and his wife are going to Medicare. He was able to purchase a MEDIGAP plan with no medical underwriting because, technically speaking, this is his first year in the Medicare system. For most of us, that'll happen right at age 65. So if you don't know which of these two options you really want to do, your first year signing up, I would encourage you to consider original Medicare with a MEDIGAP plan. That allows you to get into that supplemental plan with no medical underwriting. And once you're in there, you're in. Your MEDIGAP plan will get more expensive each year as you get older, but that's par for the course, but you're in. Many people want to start with an Advantage plan because they assume at the beginning of retirement they're younger, they're healthier, and I would agree largely with a lot of those statements. But keep in mind, you'll want to switch to original Medicare as you get older and are starting to consume more health care. And the whole premise of being able to switch from an Advantage plan the opposite direction back to original Medicare is based upon finding an affordable Medigap plan. Again, after year one, you would become medically underwritten. I anticipate we'll get a few questions in the Q&A portion on what I just said there, and I'm happy to clarify as well. Let's finish with just a few more points, which are enrollment opportunities. If you are receiving Social Security prior to your 65th birthday, you are auto-enrolled in Medicare Part A and B. Most people receiving Social Security probably want to go on Medicare at age 65. Keep in mind, you cannot be on the Affordable Care Act if you're Medicare eligible. Your cards will be mailed to you, but there are certain people who get these cards mailed to them and they're not ready to go on the Medicare system. Inside of your packet in which your A and B cards were mailed, it explains how you can reject Medicare Part B. Remember at the beginning, I said no one's going to be on a work plan and Medicare at the same time. The only part of Medicare you may ever own or would ever own while you're still getting your insurance through an employer plan is Medicare Part A, because it's $0 a month. For anyone who contributes to a high deductible plan, you don't even need to sign up for Medicare Part A at 65. The reason being is if you sign up for any part of Medicare, including A, you lose the right to contribute to your health savings account. And unless your plan is to be on Medicare insurance, we don't want to take that opportunity away. The initial enrollment period is 3 months before the month you turn 65, the month of, and 3 months after. There's a special enrollment period, and that applies to those who are working past 65, but not just working, getting their insurance through what is referred to as a creditable insurance plan through an employer. You have up until 8 months from separation of that employer plan to sign up for Medicare with no penalties, but none of us on the call will take 8 months to sign up. We want our Medicare insurance to kick in, right? The first month we would no longer have insurance through that said employer provided plan. Lastly, each and every year there's an open enrollment period, and you can see the open enrollment period runs this year, October 15th through December 7th. You will see more commercials, more literature, more everything related to Medicare during that period of time. That's the opportunity for all those people on Medicare to switch their plans. Let me close with just a few extra thoughts. Jonas, Kyle, and myself don't offer health insurance. That's not what we do. Everyone on this call, whether they choose original Medicare or an Advantage plan, will have to go out and purchase something from a health insurance agent. No matter where you live, we would encourage you to go talk to independent health insurance agents. Why is independence important? Because you want them to shop or be able to price shop all the insurance companies' plans. Just like your property and casualty insurance, the insurance companies change their pricing year to year. By the way, 84% of Americans auto-renew in the plan they had the previous year. That's not a wise money decision. We want you to shop the price of the plan each year. We also want you to find someone who not only offers Part D plans, but vision plans, dental plans, but obviously someone who not only offers Medicare Advantage plans, but offers MEDIGAP insurance itself. And then the last thing is take advantage of the people you know. Talk to your primary care doctor, right? Make sure your spouse does as well. Talk to your friends, your family members, your neighbors who are on Medicare, right? Ask them what their personal experience has been. If you have 2 residents, make sure you're using the right one as your residence when it comes to Medicare premiums. Remember, all health insurance is priced on a county by county basis. You want to buy the insurance in the place. For those of you familiar with Wisconsin, we retired to the north. The price of living or the cost of living is much less expensive up there. The cost of purchasing MEDIGAP insurance is cheaper as you go north. A lot of people in Wisconsin turn their cabin into their primary residence in retirement. Make sure that you're out there doing the most cost shopping and comparative shopping that you can do to be easiest on your budget. I will close with this. We looked at a chart that speaks to the more you make, the more you pay for Medicare. Just wanted to remind everyone that at age 70 and a half, Americans are required to start taking required minimum distributions. And I'm pointing this out because for a lot of you, you're not going to enjoy those. And you're not going to enjoy those because it represents a forced increase to your taxable income. As your income adjusts up quite often, you get the double whammy. Shortly after taking your first RMD, you find out that they're going to increase your cost of Medicare. And the cost of Medicare went up because, again, your income went up. Make sure that your financial plan is consistently reviewing the Medicare income thresholds, and make sure you're controlling your cost of Medicare to the degree that you can. The minimum cost increase is 40%. With all that said, I want to thank you for your time today, and we're ready to open up to questions.
Hi, Ryan. Thank you for the presentation today. Very informative. First question here. How do my options change if I'm on my spouse's health insurance? Can that be considered my MEDIGAP coverage?
It's a great question, and it's one that I quite often get. To be clear, if you are insured with an employer-provided plan, whether it be your own or your spouse's, that will serve as your primary insurance. Medicare is considered secondary. So unfortunately, the answer to your question is no, Medicare does not work as a supplement. Let me give you a good example. Let's say I have a $5,000 deductible through my employer-provided plan, and after $5,000, the plan covers everything. My Medicare insurance won't kick in until I've exhausted my employer plan, which means I have to pay the $5,000 out of pocket, then let the employer plan do its thing, and Medicare would only pick up any costs that might be related. None of us should be on full-blown Medicare and an employer-provided plan at the same time.
Ryan, I have another question here. Does expected 2019 income on the healthcare.gov site include IRA withdrawals?
It's a fantastic question. The answer is yes. It includes IRA withdrawals, pension income, Social Security income, municipal bond interest. It includes a lot of different things. So maybe an individual realizes that for 2019, they're not able to keep their income low enough. But keep in mind that question starting January 1st changes. The question will say estimated income for 2020. So what I'm getting at is this: an individual could take an IRA distribution in 2019, understanding that it'll negatively affect their 2019 income, but they'll be able to use that money in 2020 as a way to keep their 2020 income low enough to qualify for discounted insurance.
In original Medicare with MEDIGAP, do you have to pay deductibles?
So the way that it works is that original Medicare is going to pay the part of the bill. So with Medicare Part A, you're going to get a bill, right? That let's say it's $1 million and you were there for less than 60 days. The only bill that you're going to be responsible for is the $1,364 deductible. You don't pay that. You wait and your MEDIGAP plan will automatically cover the $1,364. So the MEDIGAP plan eliminates the deductibles, Kyle. One mistake that I do see a lot of retirees make is they get the bill for $1,364 and they pay it. And they shouldn't, because again, the purpose and the way that MEDIGAP works is it comes in and fills in the gaps of original Medicare. So to be clear, you're going to get the bill for the $1,364 deductible, but then you just have to be patient and you have to wait for your Medigap plan, which auto syncs with original Medicare to cover that portion.
And a follow-up question to that, is the Medigap cost also per employee or per person?
So yes, Medigap is more expensive as you get older. So I quoted you the national average price of $187. That is the national average of all people with Medigap insurance. That includes the people in their late 80s and 90s and even early 100s, right? I would say as a new retiree, closer to 65, your actual Medigap cost is closer to $130 a month. The $187 gives you a very good idea of how to budget for it during your overall retirement. As you get older, it'll get more expensive.
And that is per person.
Per individual, correct. All the premium numbers we discussed on the webinar today were per person per month.
Ryan, what does Plan F cover and why is it going away at the end of the year?
That's a fantastic question. Plan F covers everything that A and B doesn't cover. It's the one thing that allows me to equate full-blown Medicare with a supplement. It's an all-you-can-eat buffet. Now, my wife really doesn't like buffets, and so I always worry about the example, but here's what I mean. You know what the price is, you pay it, and after you pay it, you get to consume as much as you want, knowing that you are not going to be handed a bunch of bills at the end. Medigap Part F covers everything that A and B doesn't. The big change that you refer to in your question comes starting in 2020. And starting next year, Medigap Part F will continue to cover everything except for the modest $185 Part B premium deductible. Okay, so the only change is your total out-of-pocket costs if you're on original Medicare with a Medigap plan for Medicare approved services. Next year will be $185. Great question.
Is it true that the donut hole will be going away in 2020?
Yes. With the passage of the Affordable Care Act, the donut hole was scheduled to cease to exist, or I like to say all the filling was going to be put in the hole by the year 2021. It is still on pace for that. I guess the only caveat would be stay tuned to pending healthcare changes, right? But as of right now, nothing's changed. The donut hole is supposed to be completely exhausted or solved by the end of next year.
Ryan, with Medicare, can federal health plans in retirement be the Medigap plan?
So if I understand the question to be right, the short answer is yes. I'll explain it a little bit differently. My mom worked for the state of Wisconsin, and my mom currently uses the state's plan as her supplemental plan to original Medicare. I would imagine, depending upon the federal benefit plan you're on, you would find the exact same thing.
Okay. Does shopping plans each year mean adopting to different networks of doctors?
So remember, with original Medicare, with a Medigap plan, if you change your Medigap plan, that's a cost-driven thing. All Medigap Part F plans cover the exact same thing. They're not unique by insurance companies. So your network wouldn't change if you're on original Medicare and you're simply changing your Medigap plan. But yes, if you're changing your Advantage plan, there's two ways to change it. You change the copay and deductible, which you could do with the same exact network, right? The higher the copay, the higher the deductible, the less monthly cost, and vice versa. Or you could actually flat out change the network. And so if you're changing your Advantage plan, I guess the answer to the question would be yes, you would potentially have a change in your network. I forgot to say this on the webinar. Last year, just short of 70% of the public did original Medicare. That means 30% did Medicare Advantage plans. In my humble opinion, 10 years from today, those percentages balance out at 50-50. As employer-provided insurance has gotten less good over the course of time, the negatives of Advantage plans aren't quite as negative. If you live in the Phoenix, Arizona or Miami, Florida area, there are hospital systems that don't accept Medicare insurance at all. And if you wanted to go one of those hospitals, the only way to go is through a Medicare Advantage plan. The short answer to the question is yes, your network could change. But remember, I still would encourage, or we would still encourage you to price shop your insurance each year. One of my good friends used to be one of the individuals who priced Medicare Advantage plans. He was the one who put together the premium prices for the employer or the insurance company. And they know 84% of people don't shop. And they pass those cost increases right on to you if you're not going to cost compare.
If you start with original healthcare, then switch to Medicare Advantage, can you switch back later to original healthcare or Medicare, I'm assuming, with or without medical underwriting?
It's a fantastic question. It means you were really thinking about this. Unfortunately not. Once you leave original Medicare with a MEDIGAP plan, to come back, you would have to prove underwritability, or you would be rated.
What if I live half of the year in one state and the other half in another? Does it matter for coverage or just the premiums?
So, very good question as well. I would say number one is you're going to want to make sure that you're buying the insurance in the state of the residence that's going to have the best insurance prices for you. And I know what the prices are in Wisconsin, but I can't necessarily tell you what they might be in Tennessee as an example. And so you'd want to make sure that you're talking to a health insurance agent in both of those places, understanding you're only going to buy one policy. The reason why the location is also important is because it comes back to that question we just got related to networks. Keep in mind, when you live in Wisconsin and Minnesota, the Mayo Clinic is very, very well known, and a lot of people might want to go there. Well, you can buy an Advantage plan through the Mayo Clinic in and of itself. But if you don't live anywhere close to Wisconsin or Minnesota, you might have a hard time getting to Mayo Clinic. Said simply, for people who don't necessarily know where they're going to be or want the biggest network, they do original Medicare with that Medigap plan. But if you're purchasing an Advantage plan, because that's the path you choose, keep in mind that there are some really big insurance companies and networks are really, really sizable, and they are, generally speaking, relatively fluid.
Ryan, I have another question here. If I stay on employer health care beyond 65, does this mean the Medigap coverage has medical stipulations where cost may be higher than joining upon turning 65?
I'm glad I got the clarification of that question. The answer is no. As long as you stay, and this is the important thing, on an employer's creditable insurance plan. How do you know if your employer isn't offering you creditable insurance? They send you a letter in the fall of each year. All right. So in my example I shared with you of a 92-year-old, this was his first year of signing up for Medicare. He did not have to go through the underwriting process for his Medigap plan, even though he's 92, because he has spent or stayed on a creditable employer plan for the last 27 years.
I have another question here. What are the implications if I retire in Europe?
I would say this, each country has their own unique relationship with the United States of America. My short guess is you're going to want to purchase any insurance option that European country might offer to non-citizens. And of course, you're going to spend time exercising your Medicare insurance mostly on trips in which you revisit the United States. I recently met a couple, I know it's not Europe, but they retired to Costa Rica. They purchased insurance, minimum insurance in Costa Rica through the government, but they spend at least 2 months a year back in the Detroit, Michigan area, which is when they consume the vast majority of their planned consumptions. So without knowing what the options are in all those European countries, I would generically answer it by saying you're going to still be on Medicare. Medicare may give you some benefit when you're abroad, but at the same time, you're going to plan on getting some healthcare consumption here in the States through your Medicare benefits when you visit.
Another question, Ryan. Are capital gains considered the same as income for the purpose of these Medicare income threshold?
Yeah, for both the Affordable Care Act as well as for the Medicare premiums, capital gains are considered as income.
How do I find an independent health insurance agent?
I actually, if I'm in a place or a county that I am unaware of someone or don't have a contact, I actually Google independent health insurance agents in the city I'm looking for. And I know it sounds corny, but in today's world, I actually go to the websites, I read the websites, and I might even call a couple of them and just verify that they indeed are there. Remember, the independent nature is so that they have the ability to price shop other insurance companies' costs or policies. The other thing is we want to make sure that they can cover all of your options. I have met too many people who sell Medicare insurance, but they only sell Medicare Advantage plans. That's only part of the story. If you meet with someone who only is licensed to sell Advantage plans, what are you going to 100% of the time get for them? I don't want you to be forced into a plan because that's all the individual sells. Maybe it wasn't the best answer in the world, but I would encourage you to not only do a Google search and make a few phone calls with the short list of specifications we outlined today, but I would also encourage you to ask your friends if they've got someone worth a dang. In a perfect world, I want my health insurance agent to call me every fall before open enrollment and ask me, has my drug needs changed? Has my health changed at all? And find me the lowest cost, best coverage plan they can find me.
Ryan, can you repeat when we must sign up and how do we do so?
Okay, so let's start with the initial enrollment period. 3 months prior to your 65th, if you are receiving Social Security already, your Medicare A and B card will be mailed to you. And if you are on the Affordable Care Act, as an example, or not getting insurance through work, you're going to go on to Medicare. And during that 3 months prior to your birthday, right, before your A and B insurance kick in, you're going to want to meet with a health insurance agent. And remember, if your choice is original Medicare, you're going to purchase a drug plan and a MEDIGAP plan. If you're purchasing an Advantage plan, you got to go purchase an Advantage plan from one of those health insurance agents. So there's no way, if you're 65 and removed from an employer-provided plan, that you're not signing up for Medicare. If you're on Social Security, they already get the process started for you by mailing A and B. If you're not receiving Social Security, you would actually go to the Social Security website, and enroll in your Medicare Part A and Part B premium or benefits. You do not have to do anything as long as you know with certainty you are on an employer-provided plan. As long as that employer-provided plan is considered creditable coverage, you don't need to do anything at 65. We would tell you still sign up for A if you don't contribute to a health savings account. If you contribute to a health savings account, you don't want to do anything at 65 other than make for certain you're on a creditable plan. But if you are contributing to or not contributing to an HSA, sign up for Medicare Part A and only A, and continue to find your insurance through work. I wouldn't be doing my job well if I didn't say this, though. Each year, you should compare what the cost is through work versus what your Medicare costs would be. Because more and more each year, I find people should actually go to Medicare instead of staying on their company plan, but it's not conventional wisdom. When you carry creditable insurance past age 65 or are on an employer plan, back to the question, you have 8 months from the separation of that employer plan to sign up for Medicare with no penalties.
Hi, Ryan. We have a listener who have a couple questions about long-term care costs. I'd like to add that Kyle and myself, we can run various scenarios. We use a lot of insurance companies for long-term care. However, since we have you here, Ryan, any thoughts about long-term care costs and vendors in general?
So I guess my quick point is the percentage of Americans who believe or acknowledge that they might have to have a long-term care stay or a nursing home stay is really, really high. Americans are really smart about the realities of getting older. And yet the truth is, last number I saw, less than 7% of American adults actually go to a nursing home. Not all long-term care is given in a nursing home, but I wanted to point that out because long-term care insurance and the conversation around it is always kind of focused on the what if of a nursing home stay. Truth is, the reason why the percentage of adults who go to a nursing home is so small is because not many adults want to go to a nursing home. More and more of the long-term care needs are able to be done in home, and these insurance products apply to those in home. So said simply, Jonas, before I kick it back to you, I want to make sure that people know that insurance, long-term care insurance, can provide them a benefit at home in many situations. And those are the products that I happen to like because, again, I myself would much rather get treated at my home than have to go to a skilled care facility. I would remind you to talk to Jonas and Kyle in greater detail to talk to them about the type of long-term care policies they're seeing consumers purchase.
If you're on an employer plan, can you stay on it and defer taking Medicare to beyond 65?
Yes. And again, you would be turning yourself into a special enrollee. But assuming that the company you get your insurance through starts over every January 1st, keep in mind in the next month and a half, you're going to start getting your 2020 premiums. I recently met an HR manager of a company in Illinois. She's paying $407 a month as the employee to be on her company's $3,500 deductible plan. Full-blown Medicare with the MEDIGAP plan is $350 a month. She would pay $50 less a month to get better insurance and a bigger network. So conventional wisdom says if you're still working, get your insurance through work. And for many of us, that is still absolute truth. But I just want to make sure that you're doing your price comparing. Compare the cost of Medicare, as we discussed today, to the cost of participating in that employer-provided plan.
Ryan, another question. Do independent agents charge a fee?
They get paid by the insurance company for the policies they send. They aren't incentivized to pay or to sell one company's insurance products over another's, unless, of course, they're a captive agent, but we've already talked about the need to find an independent one. I will tell you Medicare Advantage plans pay the health insurance professional more than a Medigap plan does. So take that for what it's worth.
We have time for one more question.
Are Medicare benefits impacted in any way if I'm still working?
Medicare benefits would not be impacted if you're still working. I just, again, really want to reinforce if there's anything to take away from that question of working past 65, it's verify with your HR department that your plan at work is considered creditable. Not only your health insurance plan, but make sure that the prescription drug plan work is giving you is considered creditable. And as long as the answer to those two questions is yes, they are creditable, you don't have to sign up for any parts of Medicare. I recently spoke to a group of grocery store employees. Their plan at work isn't considered creditable. So while they can participate in the plan past 65, they shouldn't. They all need to be on Medicare. Obviously, from the fantastic questions that were asked this over the last 15, 20 minutes, the subject itself obviously is important, right? And I would just encourage everyone as a parting shot, you have Kyle and Jonas's information. If after we hang up today that you have questions that have still been unanswered, make sure you reach out to them and we're happy to answer those questions as timely and as we can and to the best of our ability. And I just want to thank all of you again for your time here this morning. Hope you feel good about it. Have a great day.
Great. Thanks, Ryan. Today's presentation was made possible by our 401k advisors, RBC Wealth Management. A quick note before we send off for the day. There are benefits on patinanation.com that you can visit for more information, including the 401k option, as well as a group medical plan. and that is located on patinanation.com directly under benefits. And again, if you have any unanswered questions or feedback for our presenter today, please feel free to reach out to our 401k advisors, Kyle and Jonas. Again, their contact information is on the screen right now. And we thank you for joining us. Have a great day, everyone.
This has been a presentation of the Patina Nation. To watch more content like this or for more information, please visit us online at www.patinanation.com.